Clostridium difficile, presented by Jamarius Thomas from the Medicinal Chemistry course in the fall of 2016 at Valdosta State University. Clostridium difficile is a spore-forming gram-positive anaerobic bacillus. Its infections occur via fecal-oral transmission in healthcare facilities, and it can be acquired within a community. It produces two exotoxins, TCDA and TCDB, that are responsible for its virulence. Its increased resistance to standard therapy is caused by a new strand known as BI-NAP1027. It results in an increased production of both toxins and the presence of a new toxin, and the increased resistance to fluoroquinolone antibiotics. The epidemiology and clinical significance of Clostridium difficile. From 2000 to 2010, C. diff infections increased from 4.5 discharges per 1,000 adult discharges to 8.2 discharges per 1,000 adult discharges in 2010. In 2011, there were approximately 453,000 newly diagnosed CDI cases in the United States, where 29,000 resulted in death. Hospitalized patients who develop CDIs have an increased 50% cost in their treatment. The CDC has suggested that CDIs may have increased healthcare costs by $4.8 billion in 2008 in acute care facilities. Diagnosis of Clostridium difficile. Indications of CDIs involves a combination of clinical and laboratory guidelines that have been published by the American College of Gastroenterology, Infectious Diseases Society of America, and the Society for Healthcare Epidemiology of America. For patients with clinically significant diarrhea, the preferred method is stool testing using enzyme immunoassays screening to look for glutamate dehydrogenase antigens for toxins A and B. Patients diagnosed with CDIs should have increased antibiotic therapy with the choice of drug depending on the severity of the disease. This is a summary of guidelines for medical treatment of Clostridium difficile infections. It is categorized based on the severity of disease, in which a criteria is provided and a method of treatment is provided as well. There are also comments suggested for each of the categories presented. The first treatment for Clostridium difficile is an antibiotic known as metronidazole. It is administered through a drug carrier, a mucoadhesive chitosan nanoparticle for colon-specific delivery. This nanoparticle was chosen in order to provide an adequate carrier that can make it through the gastrointestinal tract. Metronidazole is in the class nitroamidazoles. It inhibits nucleic acid synthesis by disrupting the DNA of microbial cells. It is often administered orally. The pharmacokinetics of metronidazole has a bioavailability of 80% orally and a 60 to 80% bioavailability through rectal. Its proteins bind less than 20% in plasma proteins, and it has a half-life of 6 to 8 hours. The second choice of treatment is vancomycin. This drug is delivered through an mucoadhesive chitosan nanoparticle for colon-specific delivery. This was chosen in order to provide an adequate carrier that can make it through the gastrointestinal tract. Vancomycin is in the class glycopeptide. It inhibits cell wall synthesis in gram-positive bacteria and is often administered orally for best results. The pharmacokinetic data of vancomycin has a bioavailability that is negligible orally and exhibits a half-life of 4 to 11 hours in adults and 6 to 10 days in adults with impaired renal function.